Welcome to Veterinary Vertex, the AVMA Journal's podcast where we delve into behind-the-scenes look with manuscript authors. I'm Editor-in-Chief Lisa Fortier, joined by Associate Editor Sarah Wright. Today, we're discussing a first-ever JAVMA supplemental issue that was authored by veterinary technicians, and it's titled Elevating the Voice of Credentialed Veterinary Technicians in Scientific Discourse, with our amazing guest editors, Erik, Fausak, and Adesola, Odunayo. Hey, Erik and Adesola, thanks so much first for doing this. Again, as I said, first ever authored by Vet Techs, and thanks for being here with us today.
Thank you for having us.
Thanks for having us.
Yeah, thank you for joining us.
Adesola, can you describe the inspiration behind this supplemental issue and what motivated you to write this editorial?
Thank you, Lisa. I wish I could take credit for this, but this actually originally started by a different journal reaching out. They were interested in having a tech issue. And I reached out to Erik and Harold, who could not be with us today. And all three of us were just really excited about having like tech-driven scholarship. Ultimately, things did not work out. We ultimately ended up publishing with JAVMA, which I think actually worked out better for the best. We just feel that it was great to have an opportunity to give technicians an opportunity to share not only their research ideas, but have an opportunity to write scientifically.
Yeah, it's certainly fun to have something wonderful to celebrate. Other than veterinary, not just, but veterinary technicians as the scholar authors, was there a different spark? Was there a gap in the literature you were hoping to address?
Um, yeah, I mean, I think certainly there are lots of gaps as it relates to. I am a clinician, so I am always interested in how to make my patient care better. And the technicians are the ones who walk hand in hand with this patient. So, they place the catheters, they monitor their vitals. And I think we're just not hearing their perspective. There's a lot that's been done from the veterinarian's perspective, but not a lot when it comes to like hands-on patient care. So I was hoping that we could get more information from that.
I learned so much from every credentialed veterinary technician I've ever worked with. I'm so grateful for them, and they were fabulous mentors for us veterinarians too.
I agree. I remember many times during my internship struggling, and they taught me how to unblock my first cat because I was in that hospital by myself. So I absolutely could not be where I am today without some wonderful technicians.
Yeah, I remember I had my first hypoglycemic dog come in. I think it was like my first ER shifts on my internship, and I was coming up with a treatment plan, and the credentialed veterinary technician I was working with was like, "Are you sure you want to do that? Do you want to maybe round to the ER clinician and just double check?" And sure enough, yep, saved me. So yeah, great teachers. And for listeners who may not be familiar, how would you define a credentialed veterinary technician? And what roles do credentialed veterinary technicians typically play in modern veterinary practice?
So, in terms of credentialed veterinary technicians, it's a very important thing that I think is starting to become the norm across all states. There's still some areas that maybe you don't see that, but essentially these are people that are working in the veterinary clinic as a professional, a veterinary technician, that go through training, usually in AVMA accredited veterinary technician school. It can vary sometimes for an associate's degree or a bachelor's degree, but essentially they go through training and then they take a board to show that training has, or that they've been able to apply that training to some degree on a written test. And in particular, what makes it a credentialed veterinary technician extremely important, and the big thing we're hoping for is some title protection, right? There's been a trend, or for a long time, you had folks that were being trained, that went through formal training, that would take these tests and work in a clinic and working right next to somebody's kid that may have gotten hired and trained by by the veterinarian in the way that they needed or wanted. I think veterinary technicians as a role, it's a little harder to pin, and I think this is why the title has been kind of interesting. I was involved 10 years ago with the veterinary nursing initiative where we were trying to change the title over to veterinary nurses. And and in a way, I'm not sure what the right way to say it is because we do kind of occupy this entire allied health region. We're therapists, we're radiology technicians, we can be ultrasound technicians, we're phlebotomists. And then, of course, we are nurses. We do nursing care in the sense of, we'll be giving treatments to patients. We're running anesthesias, or at least in conjunction with the veterinarian in charge. So there's a lot of roles that veterinary technicians take on that you maybe don't see on the human side because they're all kind of different roles. Um, so yeah, I think that's it in a nutshell. It's a lot of different little niches that we occupy in any given practice.
As some of our listeners may know, I actually did my fellowship in Canada, so I got to work with some amazing RVTs at the Vancouver Aquarium. So how does this differ internationally?
Well, it's funny you say that. Yeah, I've been a LVT, a CVT, and an RVT in the United States. I'm now in California where I'm an RVT, but it does differ. The education may differ a little bit. Like, for instance, in the United Kingdom, I think traditionally it's more often an undergraduate program. Like I'm thinking like Harper Adams, but they're called veterinary nurses, registered veterinary nurses, and it's a protected title in the country. So you will see different terms, but right now for this level, whether you call it a veterinary technician or a veterinary nurse, we're kind of occupying that same kind of broad niche. It is worth mentioning there are veterinary assistants and training programs that NAFTA has been involved with for veterinary assistants, which is a different set of skills usually to assist a veterinary technician or veterinarian.
This importance of elevating the voice of credentialed veterinary technicians, and I think the word credential kind of encompasses all that you and Sarah were just talking about, Eric. This idea of elevating and encompassing veterinary technicians to the maximum of their credentialing license not only enhances the efficiency of the entire practice, but it also provides better job satisfaction for technicians, and hopefully we can retain them better. It's not just getting veterinary technicians through the credentialing process, but retaining them, as you well know.
I think, when you look at, like some of the burnout factors for veterinary technicians, which is in this issue, you see pay is one of those things that's really hard to surmount, right? There's no way that a veterinary technician is probably going to make as much as a phlebotomist in a human hospital, which is, one piece of a larger part of what veterinary technicians do. But I think job satisfaction is something that we can have a pretty good impact on, um, and kind of acknowledging and appreciating that role of veterinary technician. In human medicine, and this is something I would like to see emulated in veterinary medicine, is that, evidence-based medicine, for instance, it's not really called that anymore because it isn't just doctors that are practicing evidence-based um, methods. Evidence-based practice is a word, and this is the vision I really hold dear, and I've held dear for like the last 10 plus years for veterinary technicians, really being involved in the decision making and being involved in identifying what the best practices are for phlebotomy, for putting a catheter in, for putting for OR scrubs, that sort of thing. And we're seeing that. But I think veterinary technicians can play a really crucial role in improving the practice and in being involved in the research.
Yeah, I really like that. And this supplemental issue highlights, and this is the first collection, as we talked about, the articles are written by credentialed or credential-led teams. What is the significance of this for as you called it, the practice of veterinary medicine as a whole, for that whole team?
For my part, I think, one of the things we get a little lost in is that, we're busy trying to do research and we can only do research based on the funding that we get, right? So a lot of times we're limited by what scope we can use. I think, again, with evidence-based medicine, if we do really well conducted quality studies, even if they're maybe underpowered, if we can do them in a really good fashion and do enough of them, we can actually combine these statistically. And I think, for a much lower cost and something that veterinary technicians can be involved in, I think they're very interested in the everyday stuff. Like, how long can we leave a fluid bag hanging? How should we scrub our patients? So it's those practical pieces that I think veterinary technicians and veterinarians can really be involved in at the practice level to really decide or help decide what the best practice is.
So, at Adesola, many credentialed veterinary technicians have historically been underrepresented in research and scientific writing. What barriers have we seen that contribute to this underrepresentation?
I mean, I think a lot of things come to play. My career has pretty much almost exclusively been in academia, other than a couple of years in private practice. And the things I have seen, first of all, include a lack of mentorship. Just like Erik inferred to, I think people expect that veterinarians are the ones to take the lead in research. And I think that's true for probably some things, but there are many opportunities or areas where technicians can not only take the lead, but also be actively involved. Uh, but because it's not the norm in many places, technicians just kind of take a step back and say, this is not something I'm expected to do. So there's really no one to like encourage them or provide mentorship in a lot of ways in terms of like study designs. Because techs have a lot of questions when they are taking care of, like, why do we do this? Or why, oh, in my old institution of practice, we usually place IV catheters or secure them this way, but we do it differently this way. So there's a lot of clinical questions that they have. So having somebody help guide them into, yeah, we can actually design a study to try to answer those questions. I think that would be a big one. Also, mentorship in terms of like scientific writing. We all, including our technicians, we all through like college and school get the experience to do some writing, but it's very limited. So having someone to say, yeah, you can actually do this. And then obviously there's also the limitation of funding, like Erik referred to. So those in my mind, I think will be some of the main limitations. I think other things also coming from the academic perspective is when I publish or have a publication, I can, at the end of the year, put it on my CV and take it to my department head, and that is, um, reflective of what I've done that year, and ultimately plays a role in, my going up the ladder, as one would say, in terms of acknowledgement and ultimately promotion. And for techs, at least in the institutions I've been, there's really no, like compensation acknowledgement, other than maybe what's done on a small level. So I think being able to like come up with a way to inspire technicians to do more by, I mean, the recognition. I think the techs who were involved in the tech supplement in JAVMA uh, felt very accomplished and, thankful to be part of that because they got that national recognition. But I think we need to do that on an institutional level so that technicians who do that are celebrated. And I think the last, I would say, things that probably make it a little bit challenging is also the time to do research. So carving that time out away from their clinical responsibility so that they can actually collect the data and have some time to write outside of. I know that was a um, in the IV catheter study that was published in the technician issue. That was a challenge for the techs who did a fantastic job in terms of the lead author was incredible, but she had to do it on her days off and didn't really get any compensation for it. So those in my mind, I don't know, Erik, if you have any other thoughts, but those would be probably some of the big limitations that I anticipate or foresee.
Yeah, I don't have much to add except, what I've always been impressed with is energy and enthusiasm. For instance, in the private sector, a lot of folks in private practice want to be involved in this, and they don't see any direct benefit. This isn't part of a promotion package. And even for academic veterinary technicians, unless they're in an instructional role, I don't think publishing is really highly reflective of their promotion or duties. So, um, completely agree with Adesola on that.
Yeah, it's a different dynamic. I keep trying to convince our technicians to do some technical tutorial videos on how to block a cow for abdominal surgery, how to do balance films. But I think you're right. We just need to encourage them and carve the time out, especially on like now in Ithaca, New York, when it's a little bit slower because of the snow on the roads. In the editorial, you guys reference survey data showing really high levels of burnout among technicians. How might engagement in research and scholarship connect to professional well-being and maybe alleviate some of this burnout?
I think this issue is a little bit of an example of that. At least from my personal experience, I was kind of a dirty Harry of veterinary practice because the reason I fell in love with anesthesia, and the primary reason I fell in love with anesthesia is because nobody wanted to do it because it's terrifying, right? But I think giving technicians the room to kind of really identify their niche and explore um, these niches that they want to do, giving them some space to do that and really become specialized. That's what made me fall in love with the job and practice for 20 years. So I think giving the veterinary technicians that space and letting them pursue their interest and respecting, um, you know, what they've done with that, I think is a huge factor and part of what the supplement's about.
Yeah, I agree, Eric. I think certainly not research and writing is not for everybody, just like not every veterinarian is interested in doing that same thing with technicians. But for the veterinary technicians who will find, I wouldn't call it a means of escape, but one of the things I like about my job is I'm able to do a couple of different things. So if they had an opportunity, for instance, to do research or to write, that might be a way to decompress and relieve some of the burdens of just being by that patient's bedside. Because, again, I know this is a little bit of a bias because there are veterinary technicians who do other things other than patient care. But for the most part, those technicians that sit in, by the patient's bedside, which can be intense. So, giving them opportunities to maybe do other things, I think might reduce some of the burnout that we see in the profession. And then just getting a sense of fulfillment. I think that also would play a role.
Yeah, you guys have spoken to, and there were a lot of variety of article types, original research, narrative reviews, and others in your supplemental issue. Did you notice a particular clinical or research niche where veterinary technicians were more naturally juxtapositioned to succeed?
I struggle a little bit with this. I think there's a trend toward narrative reviews for veterinary technicians, but that's only because that's what we know. We know how to teach each other or, create these kind of how to's for different practices. I don't think that's a niche that we necessarily can only fill, though. And that's what I'm really excited me about this supplement. Having original studies being done and showing that technicians can do them. I think we're naturals for that too. And I think one of the things that I was really excited about too is getting a scoping review. This is, to my knowledge, maybe the first veterinary technician led evidence synthesis project on that scale that we did on the radiology with Lisa Karstens. So um, I I think we gravitate toward narrative reviews, but I would love to see a lot more than that.
Yeah, I agree. Yeah, I think certainly in many areas, anesthesia, surgery, ECC, there are opportunities for narrative reviews, but also original studies.
And Adesola, one article in the issue explores how veterinary technicians are influencing care via social media. How do platforms like that intertwine with research and professional identity?
Well, that's a great question. Obviously, social media has changed life as we know it, even for those of us who prefer to stay away. But um, I see. First of all, there is a lot of misinformation on social media. Uh, every time I log in, I see like clients who have really ill pets who try to get information online and people who are not well educated providing wrong information. So I think social media plays an important role. And when you look at the veterinary community and research, it is an opportunity for questions to be generated. So, like I referred to earlier, oh, this is what we do in our practice. What do you do? And just having those conversations will stir up uh, original research ideas that can then be carried out. And I think it also helps create like a sense of professional identity for those technicians who actually do carry out research, because then people know who they are. They develop an area of expertise where people seek them out for questions because they know they're also active uh, in identifying and carrying out research. So I think that is also like an important area where both kind of mesh. But also, I would say also disseminating research information once you publish your paper, people will post it or just say, hey, this is what we found. And I think that probably maybe works even better than the traditional means where, many people may not have the time or the access to read a publication. But that can be disseminated pretty widely and quickly in social media.
I think all of us and our listeners would agree that elevating veterinary technicians as a more integral part of the team is really important, and writing would be part of that. So, if we look ahead, what steps can practices, academia, professional organizations, and industry take to encourage more veterinary technician-led research?
I'm personally, from my perspective, very excited about, thinking in terms of evidence-based practice. So I think it starts with first being able to identify where the evidence is and where the gaps are, right? And I think veterinary technicians are uniquely poised to be able to kind of do that. Because like you say, during winter or maybe between, like we have a lot of duties, it's true, but as do the veterinarians, but I think for our opportunities to kinda start digging into practices and why we're doing it is the best approach. And I really can't emphasize enough, like, the Royal College of Veterinary Surgeons Charitable Network Knowledge has a fantastic course on how to find and apply evidence, the external validity of that. I think it starts with that, kinda just starting to dig in and then identifying these gaps and maybe coming up with ways that, again, if we do it well, even if they're a little underpowered, I think if we get enough of this stuff done together, you can actually see research that's beneficial to the practice, to the folks in the trenches that are doing the work.
So now we get to come to the fun part where we get to summarize everything that you've shared today and what you hope our listeners are going to take away from this episode. So we both get to answer this one. If you could summarize in a sentence or two what you hope listeners take away from this special issue and your editorial, what would it be?
Well, I would say that the biggest take home for me is to, empower your veterinary technicians and give them opportunities to step up. Some of them really want to do this. And I think ultimately it's just going to lead to not only better care, but also just a stronger team because then the technicians feel included, not only in patient care, but in generation of research and knowledge.
I was just at the Regional Teaching Academy of Western Veterinary Colleges, and it was really kind of nice. We were working on a project, You Happier, kind of dealing with some of the self-care elements that may not happen in veterinary practices. And one of the veterinary faculty really spoke up about technicians going, we need to involve them because they're so involved in the care, but also the instruction and everything else. I think understanding that veterinary technicians play a very large diverse role in the veterinary clinic. They are educated, especially certified ones that have gone through technical training and formal training, and really kind of encouraging them to explore even deeper in that and giving them some freedom to dive deep into their areas in terms of practice owners and academic institutions, I think is really going to help the field flourish and really help with mental well-being in the field for veterinary technicians.
Yeah, really critical point. From your guys' perspective, was there anything that surprised you? Was there an insight that you discovered while curating or this whole supplemental issue or writing your editorial?
Well, I was a little embarrassed when working with, uh, Lisa Carson's, like, I've been a radiology technician, or I've been a radiology lead in some private practices, and her level of knowledge with PET CT and all that, I was like, "Wow." I have a it's just amazing how niche, all of these veterinary technicians go, and it's so great to see support from Adesola and the diligent work that Harold has always been doing, in the field. He's been such an advocate for veterinary technician and veterinary technician voices and has really put himself in places that everybody knows and sees veterinary technicians. He's been heavily involved with NAVC, IVEX, all of these big organizations I has really kind of surfaced what veterinary technicians do, and very appreciative of my co-editor on that, for having kind of led the charge in making veterinary technicians recognized, and Adesola for kind of really bringing this project. Adesola brought us both on in this project, and very grateful for that.
Sounds like a great collaboration.
It was. I mean, I had a lot of fun doing it, and I was very impressed by how much the veterinary technicians came together. Well, first of all, the passion. We had so many people who were interested in doing something, which again just goes to say they just need to be given the opportunity. But a lot of really well developed ideas too. I think that was, I would say surprising, but I was very pleasantly surprised to see that.
So, Adesola, what advice would you give a credentialed veterinary technician who's never published in a peer reviewed journal before?
In my mind, the most important thing is to find somebody to help support you. So find a mentor, reach out to, you know, I always volunteer myself. I'm happy to help. Not necessarily like do it, but at least maybe point you to somebody else who might be, you know, an expert in the field you're thinking about writing about. But the people you work with, I think just reach out to somebody, and that would be a good first step.
Well, Erik and Adesola, thank you so much for joining us. It's been a pleasure having you on our episode today.
Thank you so much for having us.
Thank you for having us, and thank you for publishing the special issue.
We missed you, Harold.
Yeah.
And for our listeners and viewers, you can read the Veterinary Technician Supplemental issue in JAVMA. I'm Sarah Wright here with Lisa Fortier. Be sure to tune in next week for another episode of Veterinary Vertex. And don't forget to leave us a rating and review on Apple Podcasts or wherever you listen.